Hi there, Kelcie Grace from Purl Adoption Advisory popping into our channel to briefly discuss in utero substance exposure and what we're seeing in the adoption world these days. Substance use disorder is extremely common in the United States, and therefore there are a lot of adoption situations that involve drug exposure during pregnancy. So it's super important for prospective adoptive families to do their research and educate themselves to better understand what their adoption preferences would be, what they're comfortable with, what they're open to as it relates to in utero substance exposure. The hard part about that is that the research that's out there is limited. So, while there's a lot more research than there was even a decade ago, the research that's out there does not necessarily always take into account children who were adopted out of the scenarios where substance exposure or substance use was occurring. A lot of the research that's out there is looking at children who either continued to live with a parent who was either actively using or in recovery, or children who were placed in the foster system, which many would argue is a continued traumatic scenario for a child. Another thing to kind of take into consideration as it relates to research around substance use disorder is, and in utero substance exposure, is that the folks that are willing and able to participate in those research studies are not necessarily the same type of person who is going to be considering placing their child for adoption. A lot of the folks that are considering placing their child for adoption are really in crisis mode. They don't necessarily have the time, energy, or bandwidth or ability to participate in research studies like this. The research that's out there is also not necessarily going to be considering the drugs that are maybe more popular now or more available now. Fentanyl is a really great example, or even marijuana in gummy form. And so it's important for you to understand the limitations of the research as you are doing your own education. What we do know is that there is some increased risk for physical health concerns, but the majority of the risks that are related to in utero substance exposure are around developmental delays and behavioral health concerns later in life. Now, that doesn't mean that a child with in utero substance exposure cannot grow up to live long, normal, happy, healthy lives where they are productive members of society. When you see research that shows increased risk for things like developmental delays or behavioral health concerns, that just means that those children are going to need lots of extra support and love to help develop themselves to their full potential, particularly during that 0 to 5 age range when their brain is really actively growing all of those neurons. Getting children who had in utero substance exposure involved in early intervention services and therapies as soon as possible can really help to develop your toolbox as a parent to help your child grow and develop, but also help that child have the tools and skills necessary to develop to their full potential, as well as manage their emotions and behavior as they age. So again, this was just a really brief conversation about what we're seeing related to in utero substance exposure. I really encourage everyone who is considering becoming adoptive parents to take the time to better understand the risks of in utero substance exposure and how you may be able to support a child who experienced drug exposure while they were in their biological mother's womb. Thank you so much for taking the time with me today. This was just a very brief discussion about in utero substance exposure. Our Learn page on our website has a lot more information, and if you sign up with Purl Adoption Advisory to be one of our families, we have a wealth of really awesome information, both recorded calls that we've had with professionals and ones that our team has recorded to provide you with information to help better equip you during your adoption journey. Have a great day.